Okay, so one of our patients last night came in with abdominal pain. And we had to operate as an emergency. We found a tiny ulcer and we stitched it up and she'll be fine. But when we're talking to her, her dad was there. And so we asked some questions and said, you know, she's about 2 years out. She's lost 160 pounds and she's really enjoying life. But we asked her, are you drinking any soda pop? No. And Dad said, you just had soda pop. You had Coca-Cola at my house last night. She goes, whoa, okay. And then we said, you're not drinking alcohol, are you? She says, oh, no. Her dad said, you went drinking with your friends the other night. And so then we're getting ready to the anesthesiologist, and he said, you know, is she still smoking? I said, I don't think she's smoking. Is she? Goes, oh, yeah, she's still smoking. So she's smoking cigarettes, drinking alcohol, and drinking soda pop. And then I asked her, you're not taking aspirin or anything like that? She said, well, I had to take Motrin just the other day. And I said, but you know you're not supposed to. She says, well, I was dying. I said, well, we don't like to use that adjective in my business. So one of the things for all of you who've had the surgery to remember, you're going out in life, and many times you might not be getting back in touch with me as frequently as you should. So stay in touch with me. Because what happens, as in this young woman's case, she had surgery, she did great, she's in a size 6, she's enjoying life, and a couple of years from now you're going to say, gee, I'm normal. Gee, I'm normal. And I don't have normal to offer. The surgery itself has risks, and one of the most serious and dangerous risks is ulcers or gastritis. So you remember all the things we told you. Don't drink alcohol. Now, what she thought, and she's not a bad person, we've had other people like this, is, gee, it's been years since my surgery, I'm doing great, I'm normal. She's out with friends, and everybody is having a cigarette, I'm guessing, and she said, I can have a cigarette. She's at her dad's house, everybody else is having Coca-Cola, she said, I can have Coca-Cola. And no, you can't. She wasn't taking her Tums, she wasn't eating her yogurt. I mean, basically everything that we said to do, she was not doing. Not because she's a bad person. She's a wonderful person, but she looks normal, she felt normal, and so she forgot all of our guidance. And you can't do that because you'll get in trouble. The surgery itself has many wonderful things, and she's a good example. I mean, she's thin and very attractive. She had big success with the surgery, but to go out and play with friends and do things like smoking and drinking soda pop and not eating the yogurt, not taking your Tums, can get her in trouble. So there used to be a TV show called Hill Street Blues, and at the end of it, the guy who would start at the morning report, he'd say, okay, let's be careful out there.
I have a question.
Uh-huh.
Really, since most of us are not from Vegas.
Yes.
In the worst case scenario, if something happens and one does develop an ulcer, we can't really fly to you to operate.
Right.
What happens?
You want to have a perforated ulcer near a good surgeon.
Right, no, but a lot of surgeons don't know about MGB. They don't know exactly.
Right, but they know something called a Billroth 2
Right.
loop gastrojejunostomy. So they can call me. You can point them to the website. If you're really obsessive compulsive, you can keep a drawing and a card with you. It's such a rare event. The most important thing to do as far as health and benefit and safety for the rest of your life is don't drink soda pop and don't, do these other things. As opposed to constantly drinking alcohol, having cigarettes, taking an aspirin, and going from hospital to hospital between drinks. Okay, I got a good doctor here, so.
But a surgeon can call you and.
Sure, just like you guys. You call me, right?
Right.
Yeah. So when you call me, a doctor could call me. Now, a lot of times, doctors, they think it's a sign of weakness to ask for help. So, but there's a lot of things you can do. One is call me, and we do have doctors who call. And we had a GI doctor who called about the liver. So let me do this one about the liver.